afternoon. Thank you all for coming. My name is Jo Bushko, and I'm the coordinator for Student Health Services. Can you hear me? Yes. Okay. All right. Thank you. How many of you know that you have a Student Health Services here on campus? Okay. All right. So some of you are going to go home better informed today. Student Health Services mission statement is to provide quality health and education services for you to empower yourself so you can be well-informed and self-directed in your own health care. And we find that when young people like yourselves come in, a lot of times you're coming in from your pediatrician and your parents accompanying you on your clinic visit. And now you're here in the big time and you get to accompany yourself into the health center. And so it's a great opportunity for you to get access to health care that's confidential, that is available to you, that doesn't go back to your parents. A lot of times students are worried about something that's very personal to them. They have questions about their health and not comfortable talking to their parents about it. And I would encourage you not necessarily rely on your friends about the information, but to come see us at the health center. So we do have a health center here on campus. It's in D105, which is the building over there. We have very qualified staff. They're licensed physicians and nurse practitioners, and we have a registered dietitian. And so we're all there to help you. There isn't one person who works there who doesn't love working there. So we love working with the college-age population. We feel that we have lots of information and services to offer you. And if any of you are just out of high school, I want you to know that we're well beyond the high school nurse model. Okay, so I know sometimes the nurse may give you very limited information, and pretty much sometimes they're calling home to ask your parents to pick you up. You won't see that here. Okay? One of the ways I market the health center is to talk about the 3 C's. Again, I'm just going to talk about the confidentiality. What goes on there stays there. None of your teachers, administrators, or your parents will know about it. There are people, there is a problem, not a problem, but sometimes when you're entering PCC, you're not 18. So if you're not 18, your parents would have signed a consent form that said that you can get services there. We put that in your registration form. So you couldn't register without that form being on file with us. So I just want you to know your parents have signed off on it. If for some reason there's a loose connection on that and you need help, and there are certain things we can't help you with, but I'm going to tell you what we can help you with. If you are under 18 and that consent form is not signed, we can help you with pregnancy, sexually transmitted infections, and birth control. At the age of 12, you can get access to that kind of care in the community without your parent consent. So I want you to be informed about that. We also have counseling services in the respect that we have physicians and nurses there and a dietitian. If you need more personal counseling, then I would encourage you to go to psychological services, which is in the L building, L108, and that's also free, and it comes under your the $13 health fee that you paid at the beginning of the semester. And then there are clinical services, just to let you know. We do a lot of things at the health center, and you'll learn a little bit more about that. But basically, all your visits are free. The health care is free, with the exception of some things that we have to charge you for, like a lab test, but that's very low cost, and the medications are very low cost. And birth control is available there too as well, so just for you to be aware of. So we have 2 nurse practitioners who are specialists in women's health, and so they would be a great resource for the women here, but certainly guys can see them as well if they have other issues of personal sexual reproductive system concerns. Okay. So 411 is just the information that we're going to talk about, the information on STIs. Now, there are some people here in the front who have clickers. How many of you are familiar with clickers already? Just a couple of you? Okay. These are automated devices, and it's an opportunity for Student Health Services to collect data on the students, and it kind of gives us a snapshot of who's in the room. So I'm asking these students to wait beyond 1:30. I mean, it might just go right at 1:30 that will end. But I need the data, so please stay seated till we get all the questions asked at the beginning and at the end of the presentation. Okay, so the first question is, and I'm sorry I forgot to change this over, but what is your age today? Are you less than 17? You press number 1. 17, number 2. If you are 18 tomorrow, you are still 17 today, okay? Unfortunately, but we want to get the data so it's accurate of this group. So if you're 20 or more, you're going to press number 5. We have 30 clickers out, so I know that what number I'm going for is 30 up here, and I have 23 at the moment. So if you could point up here to where my receiver is, that would be helpful. If you change your mind during you hit an answer, you think, oh no, that's not right, and you want to change it, you certainly can change it. The last one you press is the one that, thank you very much. The last one you press is the one that's going to register. So 70% of the class is 18 right now. Okay, so we have no one who's under 17, and 20% are 17, and there's just a couple there that are 19. What gender do you identify with? Male, female, or gender nonconforming? Okay, we have one more person to press in here. Gender nonconforming might be someone who is born into a female body but feels more male. Is it kind of a sense of where they are, or a male who feels more female? So I want you to know that we do have a safe campus for students who are questioning what their sexuality is. And Pasadena City College is working towards a safe zone area of the whole campus. But in student health services, we do have a safe zone area. Okay, so we have 50% of the group is going to be male and 47% female and 3% gender nonconforming. Okay, 80% of women and 50% of men do not have symptoms when they're infected with chlamydia. Is that true or false? 80% of the women and 50% of the men who are infected with chlamydia do not have symptoms. Is that true or false? Okay, I'm going to ask you guys to click just one more time. Okay, so 43% of you feel that that's true. 57% feel it's false. Somebody's going to change their mind today. Human papillomaviruses, 16 and 18, cause cervical cancer in women and in men. Cause what? So in women, it causes cervical cancer. In men, does it cause oral and throat cancer, penile and anal cancers, both 1 and 2, or neither 1 or 2? Okay, if you could just press one more time, because we're not clicking when somebody just point up here to the podium area. And we'll see if we can capture that last person. Okay, so 57% feel it's 1 and 2, and 30% just penile and anal cancers, and just oral and throat. What is a backup method if the current birth control method may fail? What is the backup method if the current birth control method may fail? So is it number 1, condoms? Plan B, next choice? Withdrawal or praying hard? Okay, so let's talk about 50%. Every person in this room, if we were to go down the aisle here, down the rows, every other person has not thought about pregnancy and how it might impact them or someone in their family or someone around them. Now this is male and female. Now certainly it's going to affect the female more because her body's going to be changing. But just think about this among teenagers, and your group is still teenagers, are still teenagers. You have to think about this. A lot of times you're kind of like in the present and a lot of things are going on, but you really need to think about pregnancy. And I'm talking about men and women. So on the back table, some of you may have seen that we do have some pamphlets on birth control methods. We're going to be talking about that. There's one pamphlet there for the guys that said what is it? It's men, babies, and the law. So you might be thinking this is fun times, but if your partner gets pregnant and she has the baby, then you are legally responsible for supporting that child until the child's 18. So it's something you need to be aware of. It's a financial responsibility legally. Okay, 90% sexually active teens with not using any birth control are likely to deal with a pregnancy within the first year of sexual activity. Those are pretty high odds if you're not paying attention and getting something to help yourself to not get pregnant. Now I'm going to tell you the first option that I would strongly support is abstinence, because there's a lot of things coming up in the slides in the next part of the presentation that you can avoid beyond pregnancy. A lot of times we think about pregnancy, about birth control, but the other thing is we want to think about the STIs that you can get. So if you're abstinent, you're not only going to take care of the STIs and you're going to take care of the STIs and the pregnancy together. So we're going to talk about birth control. This is not meant to be an all-inclusive presentation. I can't go over everything in detail. I just want to give you a brief overview so that you know that there are options beyond birth control pills. Oftentimes girls will come in, young women will come in and they'll say, gosh, I really want to get birth control. And the question we ask, well, what is it? The pill. They don't have any knowledge of what's beyond that. So I'm going to show you today what is beyond it. But let's go with basic anatomy first. You can see this, hopefully you'll recognize this as female anatomy. This is the vagina right here. This is where the penis goes in, and this is where the baby comes out. Okay? So this is the uterus right here. It's a muscular body that accommodates a 9-month-old fetus. There's an opening here. This is where the sperm goes in, and this is where the baby's head comes out. So this is all musculature. And then there's 2 fallopian tubes on either side here, and this is the ovary. The ovary actually isn't connected. This picture may look like it is, but it's not. So in a normal month of a textbook case of a woman, the first day of her period is the first day of her cycle. And she has a period maybe 3, 4, 5 days, up to 7 days. And then she, at midpoint, ovulates. The egg, right, the ovary rather, this is the ovary. It releases the egg. The egg goes up into the tube, and it travels down the tube, and it goes and it lands in here in the tissue area. If she's not pregnant, if that egg doesn't get fertilized with the sperm, then that just washes out with the period at day 28, 29. Okay, so that's a textbook, 28-day cycle. So first day of the period, first through 7 days, it may be a period. Around day 11 to 15, you're going to ovulate. The eggs are being released. And then around day 28, if that egg is not fertilized, it washes out with the period. Okay, so what happens here is that right in this area, this is normally what happens. If the sperm comes up here, it travels up the tube, and it goes here and meets up with the egg and fertilizes it. The egg begins to double in size. From cellular division in biology class, you know everything doubles in size. As it passes through here, it goes down here, it lands in here. So you have a little conceptus or fertilized egg really growing quite nicely when I get here. The point I want to make about this is this is musculature area that will expand with a baby, with a fetus. This does not expand. This is not made to expand. So it's going to be a critical point for the later part of the presentation to know about that. And just another point, and it was a new fact that I didn't know about till I was reviewing for some of this, that the part of this tube is the diameter of a hair shaft, a human hair shaft. So if you think about the diameter or the thickness of your hair, that's a very small diameter on the inside of this tube, and that's critical information to know about for later. So this is what the woman looks like here. This is the male. He's on the outside here with his scrotum. He has 2 testicles, and this is where the sperm begin to develop their production, and then as they mature and move on towards their production, they sit up here in the epididymis. And when they're then getting ready to go through the ejaculation, or the guy comes, then it goes up to the vas deferens. It goes out behind the bladder. More fluid is added to the semen, and then it goes out the shaft of the penis and through the urethra, which is the opening to the penis. Okay, so that's what the guy looks like, and that's the woman. I did forget to mention at the beginning of my opening that I am a nurse by training, nurse practitioner. And so I'm bringing clinical photos to you today. They're not all going to look like this. You're going to see some real life photos. And so I'm going to tell you that it can be uncomfortable for you, but I'm going to ask you to bear with me. Okay? Okay, so again, this is just a top view, and then this is the cervix. This is the opening. So if I were to put someone on the table and look up into the vagina, then I'm going to see this opening here. And this is, again, where the sperm goes in and where the period and the baby comes out. So it looks like a donut. Yeah? So when I was instructed about this, I was told, if you want to know what it feels like, put your finger on your nose and you'll know what it feels like. But I'm going to tell you as a nurse, if you want to know what it feels like, put your finger up there and feel it. Okay. The other nursing piece of it is that I went to school here. I got my basic nursing. I started out with the LVN program here, and one of my nursing instructors, when I was exactly your age, 19, said, if you don't know what you look like down there, then get a mirror and find out. Now that sounds kind of like graphic, but it was really important for me to hear, and you need to know what you look like. And the reason is because if something goes different, if you know something isn't quite right, at least you know what you are when you're feeling normal. So I encourage men and women to get a mirror and look what's down there, okay? Find out what's normal for you. You may have some skin lesions that are normal for you. You need to know that. Okay, so this is a real life picture of what a cervix looks like. And I want to say to the women that if you come in to see us at the health center, you can ask to see your own cervix. If you go through a pelvic exam with us, we have mirrors there, and you can look and see what your own cervix looks like. Just ask the practitioner, can I see what my cervix looks like? And we'll show it to you. Because every cervix looks a little bit different. Okay, so let's talk about birth control methods. There's the sterilization, which is what? What's sterilization? Where you can't have children. What do they do with guys? They cut the tubes. And with women, they cut the tubes. That's so the egg can't pass through the tube and the sperm can't come up through the tubes for the guy. The guy can still ejaculate. He's still going to have fluid. It's just not going to have any sperm in it. Okay? So that's sterilization. You're likely not going to be interested in that in this part of this time in your life, okay? But we do have implants, and these are little like matchstick products, and they have hormones in them, and they actually fit underneath your skin. They slide in underneath your skin, and they produce hormones, and they stop ovulation. The idea behind hormones is to stop ovulation, so you don't produce an egg. So that slips in underneath your skin, and it stays there about 5 years. Okay? I'm going to pass these around so you can feel them. I just hope to see them at the end. And there's also, here you go, take a look at that. So that you know what it feels like underneath the skin, you just rub your finger across it this way, and you'll know what it feels like underneath the skin. We also have intrauterine devices, and they look like what's up on the screen. It's a T-shaped device. It's plastic. This particular one has a copper wire around it. The wire acts as a hostile environment. It emits this metal of copper, and it's a hostile environment in which an egg would not want to be there. So that's the idea, the way it works. It also, the copper is lethal to the sperm. It knocks off the head on the sperm. There are three different types of IUDs. This one has the metal. It doesn't have a hormone. The Mirena does have a hormone, and it lasts for 5 years. There's also the Skyla one, and I think that's 7 years, but I'm not exactly sure. So this one is good for 10 years. So I tell the women that if you're interested in getting a PhD or not getting pregnant for 10 years, this could be a great option. It's called a long-acting reversible contraception. That's what the Implanon does, the Nexplanon. This is an older model, but we have Nexplanon now, and this is good for 10 years. So you might consider that. They're very popular. They're beginning to grow in popularity because they don't have hormones and they're long-lasting. The other thing you need to think about that you might want to have is the shot. The shot you take once every 3 months. The timing's critical. You gotta come in between 11 and 13 weeks. But that also is good for women who don't want to think about taking a pill every day or having a device inside their uterus. So that's something to think about. There are reasons that we have so many birth control methods, and that is because women have medical conditions that they may not be able to take the pill, or they may not be able to use this type of device, that a shot might be better for them. So many reasons for different birth control methods, okay? We also have the pills, the patch, and the ring. And all these are hormonal based. So the pills, the whole idea of the pill, the patch, and the ring is that you're gonna have an active birth control method for 3 weeks out of the month. And then you're going to not have that method for 1 week when the woman has the period. So 3 weeks on the hormone, 1 week off, you have the period, and then you restart the cycle. So the pills, you have to take them for 3 weeks. You have to remember to take them every day at the same time. You can't be off kilter with that. It's got to be like 8 o'clock every morning or 10 o'clock every night. It doesn't really matter the time. What matters is the timing, that you're taking it every 24 hours. So many of you students are taking lots of classes and you're working and you've got your other activities that you're involved in, and it's hard to keep the hours straight. That may not be a good method for you. The other thing is the patch, which is a hormone that's on a patch that goes on your skin, and it stays there for a week. So it's on 1 week, you change the patch, and you change it 3 times. On the last week, you remove the patch, and then that week you have your period. And then there's the ring. The ring, and you're going to see a system or a pattern with women that you have it's a round circle for women, okay? This is also impregnated with hormones. And this goes in the vagina, and it stays there for 3 weeks. And then you take it out, and you have a period. So what's nice about this, and we've heard this a lot, that women come in and they're concerned their parents are going to find their pills or their condoms or whatever it's going to be. So if you're putting this in your vagina for 3 weeks, your parents aren't likely to find it, right? So the thing about just about this, to be aware of it, it can come out during intercourse, so you want to make sure that it doesn't come out. It may come out when you're going to the bathroom, so you want to make sure it doesn't come out in the toilet. So the main thing that you want to, if it does come out, you rinse it off and you put it back in, okay? But the main thing to be aware of is that it is something that is very easy to use. So it's just one option, and you have to figure out. Now, one thing about this, if we're talking about this kind of device, you have to be comfortable touching yourself. Some women aren't, so that's not going to be a good option. She doesn't have a medical reason she can't use this, but she's not comfortable touching herself, okay? Which takes me back to the mirror in the beginning of the lecture. I would encourage you to start looking at yourself and seeing what's there, okay? All right. I do have a story behind this where one of my colleagues wasn't sure if she wanted to get pregnant. And she came home one day, she was using this particular method, and she found the ring on her dresser. And she asked her husband, why is this ring on the dresser? She said, oh, the dog. He said the dog was walking around with it in her mouth. And I thought that was one of your hair ties, so I just put it on the dresser. And they had baby number 3. Okay, so you probably have heard about the morning after pill. It probably is on, you see it in ads. This is something that's an option for you. There is the category of emergency contraception. There are 3 ways that you can have emergency contraception. One is this, which is the morning after pill. One is the IUD that they can put in within 5 days of the unprotected intercourse. And then one is taking some pills. So we carry this particular product in the health center. It's called Next Choice. You can get Plan B or Next Choice. You can get it over the counter. Up until a few months back, you had to ask the pharmacist about it, and you had to prove that you were at least 17 to get it. Those rules have gone away. Okay, but if you go to the pharmacy, you may be paying $40 or $50 for this pill. If you come to the health center, you're going to pay $9. And at Planned Parenthood, I'm not sure if they charge anything, but you can get it there. Okay? The idea behind this is if you're worried your birth control method may fail, in other words, you screwed up your schedule of taking your pills, you missed a couple days, that would be the time, if you're having intercourse, that you would have this. If the condom breaks, or if there's a situation where you're having intercourse and you weren't planning on it and it just happened, then you'd want to think about this option. Because I can tell you $40 or $50 at Rite Aid is a lot cheaper than a pregnancy. Okay? So this is something that you can anticipate if you just want to have this in your emergency cabinet, in your cabinet or your home, your purse, whatever. You might want to have something stashed there in case something like that happens. So this is meant to be an emergency option. It's not meant to be you're having sex once a week and you're going to use this, okay? It's meant to be a backup to what you have. So the most critical thing is it's best to do it, take the medication as soon as the intercourse, as close to the intercourse as you can, the one that was unprotected. But if you don't get it, you can go out to 120 hours. But really the best time is within 72 hours. The best time is within 72 hours where you can get 89% effective. How this works specifically, it delays ovulation. That means that the egg won't be released. And then if you continue to have intercourse between the time you take that pill and your next period, then you have to use birth control in there as well, condoms, some other method as well. Because we just said that we're delaying ovulation. That doesn't mean that another egg isn't coming and you're going to get nailed on that intercourse. Okay? All right. So we talk about male and female condoms. You probably know that we have latex condoms. If you have some irritation, either partner have some irritation after intercourse, and there's some scratchiness or irritation, it might be you have a latex allergy. This is one product you can use on the left-hand part of the screen. It's called Avanti. You want to get more of a different type of non-latex material in having intercourse. Then we have the female condom, and I'm going to show you what that looks like. It's called the Reality condom. It comes packaged like this, and I would encourage you to go over to Rite Aid or CVS or whatever and look in their birth control area, the contraceptive area, and check out the products. This is what Reality condom looks like. In real life, this is what you're going to see. This is a female condom. Why would we want a female condom? Why would we need one?
Don't trust the guy.
Say that again? Don't trust the guy. Yeah, okay, so you're saying you don't trust the guy to wear the condom, right? Okay, so basically a lot of guys don't like to use condoms, and they're going to be quite strong about that, and the woman still feels like she wants to have intercourse with them. This gives the woman control. She can say, if we're going to have sex, then we're going to use a condom that I have. Okay, so the women need to feel empowered here, that they can protect themselves. So it looks like this. The good thing about this is that a man doesn't want to use a male condom with a female condom. The two don't go together. It's one or the other, just because of the materials and how they are. The thing of this is that, again, you're going to see a circle. You'll never think of a taco the same now. You're going to fold it like a taco, and you're going to put it up inside the vagina, and this is the target for the guys. Okay, this is your target. So you don't want to be on either side of the sleeve of this condom because that defeats your purpose. This is where the penis needs to go. Okay? So once he ejaculates, it's caught in this area. And then you just twist it and you'll pull it out. It's very flexible. Sometimes when they're new, you're only going to use this once, by the way. And sometimes when they're new, it might be a little noisy. I'll just forewarn you about that. There you go. It's only been touched by my hands. Okay, so we worry about so we do have again, just if they're worried they might have an allergy or an irritation from the latex condoms, you can switch over to this Reality, just to keep that in mind. I think they're $2 or $3 each for each time. So this is the diaphragm. The diaphragm comes in different sizes because women come in different sizes. And if a woman gains or loses 10 or 15 pounds, she has to have this refitted. This requires to go into the clinic and have it fitted, and she needs to learn how to put it in and out. But again, here you are. You have a round disc that looks like this. You don't want a hole in it because what happens, you put a hole in it, the sperm are going to get in, right? So we just keep these with holes in them so you don't walk out with them. They're not going to do you any good, okay? Again, you're going to squeeze it like a taco. You're going to put it up inside. And what's it covering when it's inside? What's that thing that feels like your nose? Cervix, right. So it's covering the cervix. You see, this is a nice barrier method. It goes in within a half hour of intercourse. It stays in for 6 to 8 hours after intercourse. If they have repeated intercourse, then they have to put more spermicidal jelly in there and keep it in place. This is a good option for someone who doesn't see their boyfriend very often. Maybe he's at the military and he comes home and he's only going to be home a month. Might be something if the woman can't take a birth control pill or a hormonal-based method, she could do something like this. But you have to, again, be comfortable touching yourself. Okay, here you go. Okay, the sponge is something you can buy over the counter. Again, it works the same way. It's round, and you wet it a little bit with some fluid, like I think it's water, and it activates it so it's spermicidal, and then it'll kill the sperm once the sperm are in there. It's a one-time use item as well. You can go again to Rite Aid, look at all the different preparations. You can have suppositories and gels and foams, all those things, and they're going to be available to you over the counter. So you don't have to see someone in the clinic to choose this. Withdrawal. What is withdrawal? What is it? Some people use withdrawal as a method, and I heard the word here. What is it? Pull out. The guy pulls out right before he ejaculates. But we talked about this in the group on Wednesday, and the guys admit it's pretty hard to do because it's such a split-second decision, right? So if the guy's ready to ejaculate, sometimes it's really hard to pull out because you want to kind of finish it off inside. So it's not an option, really, sometimes for some people. So if you know your body really well and you can do it, that's fine, but it's not foolproof because the pre-cum, what some guys call magic juice, has sperm in it. Okay, so the other thing that you can use is a calendar and taking your temperature every day. I'm not going to encourage you to do that. If you want to learn about that and how to do it, we'll be happy to help you about that in the health center. But generally, that method is used for people who want to get pregnant. They want to know when they're ovulating and they're trying to get pregnant. And again, it's not a foolproof as well, but it is an available option. Okay. So let's talk about lubricants. And I mentioned to you, and I keep saying it, if you're going to get some irritation, that's something that could set you up for an STI. So we want to look at lubricants, and we know that they can make sex more fun, and it can be easier if you're having trouble with lubrication. You have to have less friction because if you have more friction, you're subject to micro tears. And so you want something that reduces the evidence of micro tears. Hey guys. Sit up. All right. All right, so the problem is that when you have an interior lining, either your urethra or inside the vaginal wall, your risks go up of getting another STI, such as HIV transmission and herpes. So let's look at some options in lubricants. We've got Vaseline, Wesson oil, Astroglide, Johnson's baby oil, butter, Ready Whip, okay, so I will tell you, who can tell me why I'm crossing these off? Yeah, okay, so, you know, it's in the heat of the moment, and you think, oh my gosh, I need something, and you run to the kitchen and grab this. Do not grab any of these. Why don't we want to grab these? Why don't we want to grab these? It increases infection. That's one thing. It can increase because you've got this sort of oil. But the basic bottom line is that it's oil-based, and the oil will damage the condom, and the condom has a higher risk of breaking. That's why we don't use it. Okay, so always use a water-based lubricant. We give away one in the health center. It's called Astroglide. It's a great water-based lubricant, but there are others to try. So I would encourage you to experiment and check those out. Ready Whip is fun. I can tell you that's fun, but don't try to use it as a lubricant, okay? All right. So a good idea, we want you to be using condoms, and we want you to use them every time you have intercourse because it helps prevent a sexually transmitted infection and a pregnancy. So we're going to take a condom break, and let's talk about condoms. You probably are already pretty familiar with this, but I want to go over it, and I'm going to ask for a male volunteer to come up and help me show how this goes on. Let's go over some of the finer points of. Let's go over a finer point. Sit down. I didn't say yet. All right. Hold on. Okay, so we have the package. We have the package. And how do we know? We want to make sure that the condoms that we use aren't damaged already, that they don't have holes in them already, right? Okay, so how do I know it doesn't have a hole in it? It's not open, yeah, that's true. But also you want to feel it because when they're packaged, they have a little air bubble in them. So if you feel that air bubble, which I can feel up here, there's no hole in it. The other gentleman here said that you want to check the date. That's true. You want to make sure it's not expired. So this one is good until 11/13. Wow, it's next month. All right. So by the way, we do give away free condoms at the health center, so you just walk in and pick them up. At the end of this presentation, you'll see some free condoms on the table that you can help yourself to. Okay, so the expiration date's good, the bubble's good. When I open it up, I do not want to do this with my teeth. Okay, some people might be inclined to want to do it with their teeth. Don't do it because you can put a hole in it. Be careful with your nails as well. You want to open it up so that you don't have a hole in it. Okay, so the thing about the condom is that we encourage you to use one that has a reservoir tip in it, so that gives you a little extra space for the ejaculation. Because there's a lot of pressure when you ejaculate, and when they're rounded tip, they're more likely to break. Okay? So the reservoir tip is there for a couple of reasons, but that's the main reason. You want to make sure that you're putting it on correctly. And then when you put the condom on, as soon as the penis is hard, that's when you put it on. You don't play around a little while and then decide to put it on. Because chances are the playing goes on and you forget the condom. All right? Okay. So what do guys complain about condoms? Doesn't feel good. Yeah, decreases the sensitivity, right? So the option that you can deal with that is that you put a bit of that lubricant I spoke about, the water-based lubricant, you put it in the little reservoir here. You put the lubricant on the shaft of the penis when it's hard. You roll the penis down. You want to squeeze out the air, roll the condom down over the penis, and then you put more lubricant on the outside. Okay? That increases the conductivity, and the sensitivity is reported to be better. So that's an option. So you have some homework this weekend. All right? Okay, so this is where the guy comes in. Where is the guy who's going to come up and help with this? Come on up here. What's your name?
William.
William.
Yeah.
So William's here. Why don't we start out by giving him a hand? Okay, so we don't have lubricant today, so we're just going to squeeze. When you put the condom on the hard penis, you're going to squeeze it and then put it on and roll it all the way down. So what I'd like you to do is put your thumb inside. And
Are
put
you
your hand.
putting on my hand?
I am.
All right. Feels really good, you guys.
So the question for the ladies is it too small? No.
This one is.
No. Don't open up your hand here. Okay.
Okay.
That's pretty cool.
It's not cutting off circulation. I
Not yet.
promise.
Yeah. Okay. So the other point I want to make here too is that once the guy has ejaculated and before he goes really soft, you want to put your fingers around the base of the penis and pull out. Either partner can do that. But the reason you want to do that is because there's a little ribbing here, and if it can catch on the outside of the partner and pull off, and then the whole plan has been defeated because it comes off inside the partner. Okay? Great. So The other thing I say at this point is that I tell the women that if you got something this big coming at you, get out of town. Here, hold on a second. Here you go. You might want some.
Yeah, that'd be great.
You want just this or you want some?
No, that's fine. Yeah.
You're a good sport.
Thank you.
So William was a good sport, so he gets lunch at Subway.
Okay, thanks.
Okay, that kind of wraps up the piece about birth control. Are there any questions anyone's brave enough to ask? Yeah. He asked if you're ready to go again. When you're ready to go again, you put a new one on. Yes. It's a one-time use only. And I would ask you to pull it off, put a knot in it, and toss it. Okay? In the can. All right. So we're going to go forward now and talk about sexually transmitted infections. This is much more graphic. You're going to see real clinical pictures. I'm just letting you know that. We do have over 20 different types of STIs out there, but I can only talk about a few. I can't even cover hepatitis B, which is important for all of you to know about. It's sexually transmitted. I can't even speak about HIV today because I'm really going to, not that those aren't important, they are important, but there's just so much time to keep your attention, and so I'm going to hit the bigger ones for us right here today. So 1 in 2 sexually active persons will have a sexually transmitted infection by the time they're 25. That's 50%. Again, it's every other person in this room. So those are pretty significant statistics. Women are more vulnerable than men. Why would that be? Yeah, but why are they more vulnerable? We're going to move away from pregnancy and just talk about an STI. Why are women more vulnerable than men in getting a sexually transmitted infection? More surface area? Okay, anything else? No? I'm going to give you a hint that it's an anatomical reason. She's inside. She's more internal. Exactly. And so she has this, she's a receptacle, quite frankly, and he goes in and he ejaculates, and whatever he ejaculates besides sperm is there. Whatever's on his penis is there, and she's left to absorb it. He pulls out, moves on. She's got it for a few days before it moves on itself. I just want to make the point that a woman can start her period, and she doesn't know it for a couple days because it hasn't dropped down, the flow hasn't come down far enough for her to know. That's the same thing with this. You can be exposed to organisms and not know it. So you want to ask about getting tested. This is really critical. If you are sexually active, you should be testing for chlamydia to begin with, and then there may be some other ones that we have to start talking about. So the risk factors for STIs is sex at an early age. What is the average age of first intercourse? 15. Average age, 15. 15. Okay, and if we want to talk about oral sex, what do you think the age is? It's young. We're hearing 4th graders. So when you're talking about oral sex, you're not talking about risk of pregnancy, but you are talking about risk of sexually transmitted infections. Okay? Multiple partners. The more times you have sex with different partners, the more risks you have. The risks are going up. Okay? I read a statistic where over a lifetime, women have 10% chance of getting cervical cancer, but every time they have a new partner, it goes up by 10 or 15% with each new partner. So it's something to be aware of. So you have multiple partners, you're having sex at a young age, and it's unprotected. Because when you're 14 and 15 and 16 years old, you're not thinking about that. And you may not be thinking about it in your early 20s. But if you're having unprotected sex, you're having exposure to organisms that you can't see. Now I use the example of having sex with those who've had sex with others. So you're having multiple partners when you're having sex with people. And the reason is because when May has sex with Kent, And then Kent goes on and has sex with Chris. Chris is actually having sex with May and Kent. And then when Chris goes on and has sex with Alex, Alex is actually, on a cellular level, microscopic level, Alex is having sex with Chris and May and Kent. So whoever you're sleeping with whoever they slept with and that person again. Now, I intentionally left the names Chris and Alex neutral, or gender neutral. And so Chris could be female or male, Alex could be female or male. And so we do have bisexual individuals. And so if someone's experimenting and they don't know, they're questioning, they're not sure, there can be that bisexual exposure as well. So just to be aware of that. Okay, so here's your normal cervix. And now we're going to see something a little different. So this is a normal cervix. It just looks a little bit different. But I want to point out this is the opening, this is the os, and this is again where the sperm goes in, the baby comes out. You can see that the tissues are a little bit different. When we do pap smears on women, we check for precancerous lesions. This is what we're checking. We take a little brush and we just go over that a little bit with a brush. It's painless. We capture some cells there and we look for changes. When women are infected with the organism that causes cervical cancer, this is what we're picking up right here. Okay? So that's normal. You can see normal life reflex. There's no lesions there. There's nothing happening. Here, it's immature. And so you can see that tissue is really vulnerable. I mean, you don't have to be a clinician to see that this is really vulnerable. And so if this person's like 12, 13, 14 years old and she's having unprotected sex, you can see why she would be more vulnerable for getting a sexually transmitted infection. Now, a 22 and 24 and 28-year-old can have a cervix that looks like this too, just to be aware of that. But I'd make the point because when you're young and you're developing, your cervix can look like this and then eventually it goes away. This is the infected cervix. You can see it's red and it's kind of friable looking. You know, it kind of looks like it could bleed easily and it has a discharge, a pussy discharge. So chlamydia, which you may remember from the beginning slides, is a bacterial infection. It is the most common bacterial infection among the sexually transmitted infections. Most common. It is in the college-age population like no other. It's the highest, that's the worst problem we have in your age group, 15 to 25. So 80% of the women are unaware that they have this infection, 50% of the men are unaware. The symptoms can include an abnormal vaginal discharge, bleeding after intercourse, painful urination, and penile discharge. But remember, women are inside, they can have this infection and not know that they have it. With gonorrhea, that's the other sexually transmitted infection that's based with bacteria. 50% of the women don't know they have symptoms, and 90% don't know that they have symptoms when it's a sore throat. So we're going back to oral sex again, and when you have oral sex, you are at risk for getting gonorrhea if you're not having condoms, using condoms for oral sex. Okay? So on that note, I just want you to know that we do give away flavored condoms in the health center. So we have banana and chocolate and strawberry and mint. So there's about 5 different flavors there for you. So you can stop in and pick them up, okay? Incidentally, I do have a Magnum up here. We give those away as well. But for the guys, I just want you to know that a lot of this is partially marketing because these Magnums are only 1 to 2 millimeters larger than the one I had up here on William. Thickness of 1 to 2 millimeters, okay? Or the diameter of it. Okay, so I want to go back to oral sex. We do have a problem with gonorrhea. It is approaching superbug status, which means we are running out of medications to treat it. It is a serious infection, and it's something that we have to watch for and screen for. So when you have gonorrhea, you have some painful swelling. You can have burning with urination. Usually the guys will come in, and they may have some tingling, and we'll treat them right away. I will tell you, if a guy comes in and says something's really different, I'm having tingling or burning sensation when I'm urinating, we will treat you right there on the spot for chlamydia. Most often it's chlamydia. But a lot of times chlamydia and gonorrhea run together, so we'll test you for both. If it goes untreated, then the guy can get into urethral scarring, and a painful epididymitis. That's where the tube sits on top of the testes. That can get inflamed and infected, and it can result in not being able to father a child. So that's something to be aware of. With women, it can migrate up the cervix. It can go up into the uterus and in the fallopian tubes, and it can cause pelvic inflammatory disease and can result in infertility. It's something that we're very worried about in your population. So one thing about gonorrhea that's separate from chlamydia, it can go on to your brain and your heart and into your joints. And I personally know someone that it went into their joints and she ended up in the hospital with it. So it is a serious infection. It makes you more susceptible to HIV infection just because of the way it impacts your system. If a woman were to give birth while she had an active infection, she could pass it on to her child, her infant, her newborn, and that could result in blindness. Okay, so here are pictures now. This is the outside of a woman, and you can see she's got sort of a fullness here that's red. That's an abscess that's probably caused from either gonorrhea or chlamydia. And this is just a hyperpigmented woman. She has something a little different, but it's along the same line. This is a cervix. Now this one looks different. This one kind of looks angry, don't you think? It's reddened. There's discharge from it. This is a pussy discharge, and this is the point where I tell the guys, when you go in without a condom, the end of your penis is going right into this discharge. And you're not feeling that. It just feels the same in there. You're not going to know. Okay? This is another discharge. Again, here's the cervical opening, and there's discharge all around there. Let's give the guys equal time here. This is the guy who has a pussy discharge. It's something that you need to be aware of. I can tell you this guy is going to be in the clinic because that's not normal. Okay, so when you have gonorrhea, chlamydia, we worry about women in particular going on to pelvic inflammatory disease. That's when the pelvic organs get really congested, inflamed, and uncomfortable. It can result in infertility, an ectopic pregnancy, or chronic pelvic pain. This is very uncomfortable when you can't sit and you can't have intercourse because it's too painful. This is pelvic inflammatory disease. This is normal fallopian tube. This is what it looks like when it gets inflamed and swollen and uncomfortable. So what's an ectopic pregnancy? Okay, so an ectopic pregnancy is when a pregnancy occurs outside what's normal. So remember, what's normal is that the egg goes down here, implants, and grows into a fetus. When you have an ectopic pregnancy, that can happen where, if you recall at the beginning of the lecture, I said it's a very narrow, and if you have scarring from an STI, like gonorrhea or chlamydia, that scarring can cause the developing conceptus to stop. And so as this conceptus is going down, the fertilized egg is going down here, it can get stopped on a narrow part of the tube because of the scarring. And remember, it's just the size of a hair shaft in some places. So if it gets stopped and it's stuck and it can't move, but it's growing, what's going to happen? It's going to explode, but it's going to rupture. And that's a surgical emergency for the woman. She's going to be in the OR. She's going to be having this opened up, and they're going to have to take out that's not a viable product anymore. That conceptus is not going to survive. It's done. But then they're going to try to repair this tube to put it back together so that she can get pregnant another time in her life when she's ready for that. Okay, so this is a surgical emergency. So when you have an STI history, you have an increased risk of getting an ectopic pregnancy. Increased pregnancy of ectopic pregnancy, you have an increased risk of being sterile or infertile, not being able to conceive. Because if you blow out this side, you may be only left with this side to get pregnant. So we offer free chlamydia testing. It's a urine test at the health center. It doesn't require an exam. You come in and say, I just want to do the STI testing. We will do it for you for free. You just can't pee for an hour before the test. Okay, you do the test, we send it in. If you come back positive, we're going to treat you at the health center for free. If your partner is a PCC student, we'll treat your PCC student partner for free. If you turn out to be positive for chlamydia, we're going to go on and test you for gonorrhea, syphilis, and HIV. We do have an HIV counselor at the health center on Tuesdays, and he does the oral test, so you get your results right at the time of the appointment. Okay? If you're not positive, but you want to do the other tests, then the tests are low cost, but you can get those through us as well. We'll worry about herpes, that's a virus. The one thing about chlamydia and gonorrhea, it's pretty nice because we do have antibiotics. When you get into viruses like what we're going to talk about now, we don't have treatment for that. We only have medications that kind of can reduce the symptoms. So you have herpes 1 and 2, no cure. If you know someone who has fever blisters on their mouth or cold sores, don't allow them to go down on you, okay? Because it can be transmitted to your genital area. And if you have that, be responsible and don't go down on someone because you can transmit it to their genital area, okay? If you, now the thing is with oral sex and genital sex intermixed, the two can mix up. So you can have genital herpes at your mouth and you can have oral herpes in your genital area. The main thing about the virus is that it's stored in your skin and it's always shedding. As your dead skin flakes off, so does the virus. So although it's a less risk when you don't have the active lesion, it is possible to get it. It's a much less risk. But when you have an active lesion, you are shedding virus that is communicable. This is what it looks like on a man's penis. And you can see that it's kind of a blister. This hurts. This guy would not be in school today. It has its natural progression of what it does. It breaks up, they erode, they become ulcers, and you're going to see what it looks like on a woman when it becomes ulcerative. This is very painful. She would not be sitting in this class today either. Okay? So you do not want to have exposure to this. And I didn't mention, but we do have dental dams as well, and they come in different flavors, and they come in latex and non-latex. If you're having oral sex, you may want to have a dental barrier. Okay, this can be purchased. We have them at the health center. You can stop in and ask for them. They're there. But you need, if you're having oral sex, you need to have a barrier because you're not going to know if someone's got an infection with that or not. They're not even going to be talking to you if they look like that. Okay. Why do I have Michael Douglas up here? Why do I have Michael Douglas? Anybody? Huh? He's the man. Michael Douglas, you may know, just separated from, what's her name? Catherine Zeta-Jones, right? But he was in the news about a year or so ago because he's been diagnosed with throat cancer. And the underlying problem with throat cancer is that it's caused oftentimes, most likely, from HPV, human papillomavirus, which is the most common viral infection in the United States and I think in the world. So when we talk about the chances of you having an STI between now and 25, this really increases your chances because it's a viral infection. It's called human papillomavirus, and there are over 100 different strains of it, but 40 of those different types can come from a sexually transmitted infection. Okay? Of those 40 types, 4 in particular are linked to cancer. Cancer of the cervix, cancer of the penis, the anus, the vulva, the outside of a woman, and the throat. So we're seeing a big increase among the oral cancers, and this is the underlying problem with it. It's more noticeable in men right now, but I just saw an article the other day that said that by 2020, the year 2020, throat cancer based on HPV will outpace cervical cancer in women. That's a pretty significant statistic. So it's the most common viral infection. You can get it skin-to-skin contact. So if you have warts on your skin and you come in contact with someone, you can get warts that way too. It's a virus. Viruses are very common. We live with them all day long. But when they're genitally based, then we have to be more concerned about that. You don't have to do it to get it. You just have intimate contact. Someone's got some warts, you can get it too. Okay, so a condom only provides some protection because they can break and you can have exposure that way to it. And the condom's only going to cover that area that it covers. So the whole skin folds and the area the skin around it's not going to prevent you from getting HPV. So we worry about 6 and 11. This is the low risk HPV. It causes genital warts. Most people will have these, not know that they have them. They can be pink or gray. They can be raised, flat, single, clustered. They look like cauliflowers. So between tacos and cauliflowers, you're not going to have you're going to have a different reference now, okay? So they can it causes itchiness and irritation. So that might be your first clue that you have it. Sometimes women have a vaginal itching area and they think they have a yeast infection. This is actually what's the underlying problem. This is what it looks like on a woman. Now this is a different case, but when I said to you that you have skin-to-skin contact, you can also have what we call auto-inoculation. In other words, you can give it to yourself. So this woman probably gave it to herself in that when her legs came together to walk, she crossed over. And that's why you see the two lines here. You can see there's a row here and there's a row here. And then there's little spots up in here, all this area here. These are all little venereal warts or genital warts. On the man, it looks a little bit different. Now, he can look like this. And I've actually seen a case on a man where he came in, and the best way I can describe it to you is that his entire scrotum was covered with warts, and it looked like someone had lopped off the top of an eraser from a pencil and just pasted it on his scrotum. And it was full, and I said, how long has your scrotum looked like this? And he said, look like what? He had no idea that it was different. There's another guy who wasn't tuned in. Now, the place where I found this fellow, where I was practicing at the time, was a chemical dependency program. So it's possible that he was, under chemical influence a lot and just wasn't paying attention. But that's why you need to pay attention to your body. Guys could miss something like this, okay? That is infectious, though. It is communicable. So the main thing is, so that's the low risk. So the low risk numbers, 6 and 11, cause genital warts. Then we worry more as well about 16 and 18. These are high risk. You can have no symptoms. We might pick it up on a pap smear with women. She can have bleeding or spotting in between her periods or after intercourse. This is the cause of these cancers, of the cervix, the anus, the penis, the vagina, the head and neck. So 16 and 18 are the causes for throat cancer in men as well. This is what it looks like when you look at it at someone and you're looking at a cervix again. You see this area, if I were to take a little wooden spatula and try to scrape that off, we couldn't scrape it off. That's what it looks like. So guys, you're not going to feel this. I'm telling you, won't feel this. The other thing I want to point out for those of you who are smokers, smoking increases the proliferation of warts. And they have found carcinogens in this mucosa. It's a cofactor with HPV infections. So when women have cervical cancer, one of the things they are going to ask them is, are you a smoker? So if you're a smoker, you're increasing your chances here of having a problem. Cigarettes. So when we're smoking cigarettes, we're talking about the carcinogens that are made in it. And the jury is still out on those e-cigarettes, by the way. This is what it looks like when it gets to be very proliferative. Okay, this is pretty significant. It's up in here as well. And then for the men, we'll give you equal time. So these are all warts around here. This is perianal warts. So I leave the little light going on there because I encourage you to leave the lights on, okay? You want to check your partners for clues. Check your partners for any discharge or any little skin tags. Okay, so the good news here, the good news is that we have a vaccine that prevents these. Sign up right away, yeah? Okay, so basically we're worried about these four. There is a vaccine on the market called Gardasil. It's been out since 2006, and it is recommended that you take it, that we started around age 11 and 12 for girls and specifically, but men are encouraged to get it as well, and particularly up around age 19, 20, they should have it. I'm going to ask a question. If we find on a pap smear a woman is infected with one of these, number 6 or number 16, would you encourage her to get the vaccine anyway or say, no, we're not going to do that? Get the vaccine anyway. Because she may be infected with 16, but we can help protect her against 6, 11, and 18 as well. Okay? So please know that if you do not have an insurance right now, that at the health center you can come and get this vaccine for free. It is worth $400. If you had to pay the outside price, go out to a clinic and pay for it, it's a series of 3 shots, you'd be paying close to $400 for it. But if you do not have insurance currently, you can come to the health center. We're under a patient assistance program where we can give this to you for free. I strongly encourage every woman and every man in here, if you're sexually active, even if you're not, get started on this and get protected, because it ends at age 26. Okay? So the take-home message is to be informed, get yourself tested, and get vaccinated. You've had a lot of information here today. I can't possibly go over what more there is there, but you certainly can come in for more information. You can come in on individual counseling. So hold on a sec. I'm going to ask you all to remain seated, please, because I want to go through these last final questions. This is for the men and the women who have the clickers. 80% of the women and 50% of the men do not have symptoms when they're infected with chlamydia. So is that true or false? Just point and click. Point and click one more time. So the answer is true. So there's a difference in opinion there. Human papillomaviruses, 16 and 18. I'm going to ask you all to be quiet, if you please can, because I need to get this information here at the front. And I'm open to any questions that you may have as well. So human papillomaviruses, 16 and 18, cause cervical cancer, and in men cause what? I'm going to need all the clickers up here in the front when you're done with them as well. So good? What is the backup method? The current birth control method may fail. I wanted to make an announcement as well. Ms. Tran is going to be stamping your passports for you, so please don't leave if you need that passport stamped. Good answer? How many sexual partners have you had in the last year? Could I ask you to stay? I have a few more questions. Yeah, you will. When you're done with it, please. Okay, there's some significant numbers here. I just want to say that this group is higher for no partners in the last year than the other previous groups. However, there are more among the 3, 4, and 5. So I would encourage those who fall in that category to definitely come in and get some testing done. This is what a normal PCC or average PCC student looks like. They've had 30% about no partners or one partner, and then a lower amount. So this group is higher for number of activities or sexual partners. If you're wondering about your relationship, if it's healthy or not, you certainly can go to thisloveisrespect.org. I need your feedback if you just answer this question. Did the presenter help you identify a specific health risk or behavior that you could change which would protect or promote your health? In which category did the health risk behavior belong? Was it in the availability of a lab test, health risk reduction behaviors, health counseling, or birth control education? Thank you. If you could just point up here and press for me, please. And one final question. On a scale of 1, not interested, to 5, very interested, how committed are you in changing your health risk behavior and in protecting and promoting your health? Great. If If you could just drop the clickers up here, that'd be great. Help yourself to the stuff in the back. Thank you.